Neonatal Care Part 5. We're going to continue talking about specific conditions. Respiratory distress and cyanosis, respiratory depression secondary to opioids, and premature and low birth weight infants. Respiratory distress and cyanosis. The single most common cause of respiratory distress and cyanosis is prematurity. There may be respiratory causes, which include airway obstruction, such as when we talked about meconium staining, aspiration, pneumonia, pneumothorax, a tracheoesophageal fistula, congenital diaphragmatic hernia, or immature and not developed lungs. Other causes could be CNS depression, septic shock, and severe metabolic acidosis, or cardiac anomalies. Assessment and management will include ensuring a patent airway, check breathing and make sure it's adequate, make sure your pulse is present, assess respirations, ask about increased symptoms when feeding. Treatment will include, again, keeping an airway patent, giving oxygen if necessary, effective ventilation, and making sure adequate circulation is happening. If resuscitative efforts do not result in improvement, a needle thoracentesis may be necessary. Respiratory depression secondary to opioids. Administration of naloxone or Narcan to the newborn of a mother with opioid use disorder may precipitate seizures that can potentially cause death, and is not recommended as a first-line drug in resuscitation. Note again, this is for the mother with opioid use disorder. For respiratory depression from the mother's chronic use of opioids, we're going to just simply provide ventilatory support and transport immediately. However, if respiratory depression is a result of the mother being treated acutely with opioids, Narcan may be administered to the newborn via the IV, which is preferred, or the IM route to reverse the opioid effect. Again, if the mother is suffering from narcotic use disorder, then we don't want to induce withdrawal symptoms in the newborn. But if the mother is simply being treated with a narcotic and the newborn has a decreased respiratory drive because of that, we may give Narcan. Premature and low birth weight infants. So the definition of a premature: newborns are delivered before 37 weeks of gestation. Often this is idiopathic, but maternal conditions associated with preterm labor and delivery may include an infection of the mother, including a UTI, maternal illness leading to dehydration, placental insufficiency, polyhydramnios, preeclampsia and eclampsia, pregnancy-induced hypertension. This leads to an increased mortality. Morbidities are associated with prematurity include respiratory distress syndrome, apnea, hypothermia, sepsis, and central nervous system compromise. The most common etiology of low birth weight, which are newborns weighing less than 5.5 pounds or 2,500 grams, is prematurity. There are several factors contributing to premature delivery, including genetic factors, infection, cervical incompetence, abruption, multiple gestations, previous delivery of a premature infant, drug use, or trauma. Other factors may include chronic maternal hypertension, maternal smoking, placental abnormalities, or chromosomal abnormalities. Morbidity and mortality are related to the degree of prematurity. Those born at 24 weeks of gestation or weigh less than 1 pound are unlikely to survive. Those born after 32 weeks of gestation or weigh at least 3 pounds who receive cardiorespiratory support have a higher chance of survival long term. To determine prematurity, rely on physical features such as the maturity of the skin. Is the skin real thin? Is it very fragile? The size of the infant, and the degree of respiratory distress. Information from the family about gestational dating, and information related to maternal or fetal complications. To optimize survival of the newborn prematurely in the field, provide cardiorespiratory support. Provide a thermoneutral environment. Remember, these newborns are not going to be able to regulate their body temperature. and use only minimum pressure necessary to move chest when providing positive pressure ventilations. Higher than necessary pressures may cause barotrauma. Management will focus on clearing the airway, gentle stimulation, administering supplemental oxygen and positive pressure ventilations if needed, providing chest compressions, and maintaining a warm environment.